Hi! Welcome to Doc Martin's Quarantine video series. Today, we are going to talk about something that we see all the time at our intercare clinics, and that is sciatica. Sciatica, put simply, is basically just pain that travels down the back of the leg following the course of, you've got it, the sciatic nerve. This is a large nerve that is formed by the different nerve roots of the lumbar spine or lower back. This video will demonstrate some of my favorite techniques of relieving sciatic nerve pain. So, let's get cracking! The symptoms of sciatica down the back portion of the leg are usually either a deep dull ache, a sharp shooting pain, or maybe even a throbbing pain. And it's usually a well-defined line that crosses the knee and sometimes can go into the foot. Anything that alters sensory or motor perception is important. I will be discussing both causes and corrections so you can see the relationship of the technique to the cure. Please note that if any of these exercises cause an increase in pain that travels down the leg, then you should discontinue them immediately. Pulling discomfort or a stretching discomfort is acceptable, but a sharp shooting throbbing pain that travels down the leg or that intensifies is not. What you're looking for is for the pain to move away from the leg and into the back. They call that process centralization and is usually an indication of relieving nerve pressure. The most common causes of sciatica are, number one, lumbar disc syndromes. The disc is a piece of cartilage that separates one lumbar vertebra from another, and usually they will bulge or herniate towards the back, which means that the spine moves into flexion. The other common cause of sciatica is what's termed a sacroiliac joint dysfunction. This is basically a misalignment of the bones of the hip and pelvis that can impinge the sciatic nerve as it travels down towards the leg. Another possible cause of sciatica is what's called a Piriformis Syndrome. Now, this is a small, deep muscle of the buttocks. The sciatic nerve actually dives in between the belly of the muscle. So when there is tightness or stiffness in this muscle, it can actually pinch the sciatic nerve, giving you what they call a Piriformis Syndrome. And finally, you can have slight misalignments of the lumbar spine that cause nerve pressure that can affect the sciatic nerve. Alright, Elle is going to help me demonstrate some of my favorite techniques for relieving pain from sciatica. So, remember we said that most lumbar disc problems move into flexion. So, just like our neck video, we're going to use an ordinary towel to help relieve pressure off your lower back. So, Elle, so first you go facing this way and you have these two bumps below here and you put the towel here. You clip your elbow towards your side and the idea is to actually extend by using your elbow and your towel. So the towel is pushing forward and up. Okay? So here, forward and up. Okay? And you just hold it there. Now the idea is you want the pain to move away from the leg and into the lower back. Now, you can actually move side to side. So you can turn and extend more on the right and extend more on the left. Okay? Until you find that position that brings the pain more towards the back and away from the leg. You can also move it up to different segments until you find your sweet spot. So from here you go L5 and then you move it up a little bit, you can do L4, move it up a little bit, you can do L3. Just gently moving the spine into extension, left, right, until you find what relieves your pain the most. The next one is for sciatica that may be caused by problems with your sacroiliac joint. Now this is the joint of the hip and pelvis here, and this moves back and forward, back and forward. Now, what you want to do is stand sideways, support yourself here, okay? Now, lift your knee up to 90 degrees, and that moves the hip this way, and then extend it out this way, out here, here, and that moves the hip this way, okay? Again, 90 degrees, and then backwards, here. Up again, here. So what you're doing here, if you can see, is that you're standing straight. When she lifts her leg up to 90, you're moving this hip this way. And then when she extends the leg, she's moving it this way. So you're getting mobility into these joints. Repeat that about 10 times, and on the left and on the right side. The next exercise I'm going to demonstrate is nerve flossing. So what you want to do is, if you can imagine the nerve coming from here all the way down to the leg, you want to stretch it on one side while releasing it on another side. So when she lifts her leg, she's stretching the sciatic nerve, flexing her ankles also this way. And then here, she's releasing the stretch from the upper back. And then you do the opposite. Release the stretch here by bending this here. And then she's stretching it here. So you're sort of pulling one way and then pulling the other way. Go again, El. Extend there. Extend here. Flex here. Flex here. Again, extend leg. Extend neck. Flex neck. Flex leg. So what that's doing is, if this is the leg and this is the neck, you're releasing here, stretching here. Then you're stretching here, releasing here. So this is this flossing mechanism that helps unload pressure on the sciatic nerve. Last but not least is relieving sciatic pain caused by a piriformis syndrome. So remember, it's a deep muscle that runs in the buttock, and the sciatic nerve dives right in between. So to unload that, El, can you cross your legs? Okay. Keep this parallel to the floor as much as possible. And then what you do is you pull this down while you bend down, and you should feel a deep pull on the left buttock. Now we're going to demonstrate it on the other side so you can see that as well. So plant that foot, cross your legs, okay. Now keep this parallel to the floor as much as possible. Then stretch down, okay. And do you feel the stretch here now? Okay. Now, once you feel comfortable doing that, then you can place your elbow on the knee here, and that forces you to bend down even more to get an even deeper stretch of your piriformis muscle. And that should help relieve pain if it's coming from a sciatic nerve that's pinched deep in the buttocks. Do let us know which of these exercises are helping you the most. Now, remember that if the pain doesn't go away and intensifies over a course of 2 to 3 weeks of doing these exercises, it may be helpful to seek consultation with either a good chiropractor, an orthopedic doctor, or a rehab medicine doctor, physiatrist. Some warning signs to look out for are complete numbness around the anal area, or if your leg muscles actually start to shrink. If the side where you feel the sciatic pain actually starts to get smaller, that could be a sign of some serious nerve pressure. And you should seek medical consultation immediately. So, this is Doc Martin saying, every day, in every way, you are getting better and better.